everyone, Dr. Schaefer, physical therapist, here talking about knee pain in relation to hiking or backpacking, whatever you're passionate about. Usually they're the same thing. So knee pain is one of the biggest things. When I reached out to a Facebook group, is saying like, what do you guys want to hear more about? What do you want to learn more about so you can go that extra mile, find camp, enjoy the time with your friends or family, or just go out by yourself and disconnect a little bit. So knee pain was really the winner. So I want to talk a little bit, about knee pain and what it is. So knee pain can be 1,000 different things. It can be patella femoral syndrome. You can have, maybe a fracture in the knee area that you don't know about. It could be IT band syndrome. It could be, partial sciatica. It can be a shin splint that you feel is knee pain, muscle strain. The list goes on and on. One of the most common types of knee pain is what's called patella femoral syndrome. And that's essentially a fancy word for pain in the knee. Really just pain between the kneecap and the bone behind it, or the joint behind it. So if it's truly knee pain itself, so you may feel the pain in the knee, but the symptoms or the cause of it, could be coming from the knee, the hip, the ankle, the lumbar spine. So it could be all over the place. So if it's specifically patellofemoral syndrome, a lot of the research looks at the hip and strength and control of the hip in relation to the knee and in relation to how you place your foot on the ground. So what does that mean? That means that strengthening or working on the hip is going to help with your knee problems. So what that looks like is, if you look at some of the other videos that I'll have up there on my social channels, is working on hip strength, but not just strength itself. You can't just lay on your side, lift your leg up 1,000 times, and expect for your knee to feel okay when you're on the trail with 30, 40 pounds on your back going up an incline with roots that are all over the place. So you really got to know how to progress that. So that's where a physical therapist comes in, where you can find and at least get a plan for yourself to solve your knee pain, or at least to ease it. So the progression usually looks like, let's do some things on a table, let's work on some hip strength, and then let's move to standing, working on squats, front squats, lunges, single leg stance where you can control the position of the knee. Usually people tend to dive that knee inward into a valgus position, which is like towards the other knee, a crossing midline. So again, these are all things that if it's truly patellofemoral syndrome, that's the cause. There are some quick fixes that you can do to your knee on the trail that may help to ease your pain and get that extra mile to campsite, or pull filter your water, or whatever that you need to do when the knee pain's creeping up on you. But really the best solution is train yourself to a level that you can really succeed at that level. So to give you an example, like I did the Grand Canyon, it was like a year and a half ago, and I trained for like 2 months, just going to the gym looking like a fool on the stair climber, just sweating bullets. And the last day that I trained on it, it was awesome. I hated that thing, never wanted to see it again. But I went to the Grand Canyon and hiked it. But I mean, I enjoyed myself. So instead of dying and falling apart at the knees and the hips, it was much more enjoyable. You're still sweating bullets, and especially in June, but it was fun. You got to enjoy it instead of worrying about my hip gonna give out, or is my knee gonna hurt, is my back gonna stop me at the first mile. So, that's really the best thing to do, is to train yourself at a level that you're prepared for. And I think we all know that, but we don't always execute that. Myself included, like I try my best to stay active and do the things that I know are going to work, but, we're all human and stuff happens, but, that's really going to be your best solution to not dealing with knee pain on the trail, because the trail always looks way different than going into the gym, but we try to replicate it as much as possible. The last thing I want to touch on is, if it's not knee pain, if it's not patellofemoral syndrome coming from the knee itself, you could still have knee pain, but you could be having symptoms coming from, say, the nerve that innervates into the knee, a couple of them down there. It could be referred pain from the back. I've seen plenty of knee pains that are actually referred pain from the back, stemming from the low back, that drive pain into the knee. It doesn't have to be like a sciatic pain that goes all the way down, but if we move the back over and over again, and your knee pain goes away with lunging or squatting, it's pretty clear that you need to have the low back addressed. So, just because your knee hurts doesn't mean that it's just your knee, but need to have the whole picture of you evaluated, and how you wear your pack, how you're walking, the I know there was a case of like your shoe wear, your footwear. We all know that plays a big role in not just foot discomfort or plantar fasciitis, but also knee function. And so there's a lot of research all over the place. More support is not always good, contrary to popular belief. You see all this commercial with like 1,000 pounds of support. This is fantastic for my foot, but that's not research doesn't back that up and say yes, that's great for you. A lot of people flourish in a minimalistic shoe, even if it's hiking, if it's doing a squat in a gym, if you're into CrossFit. I myself prefer a minimalistic shoe in the gym because it makes me feel more connected to the ground as I'm lifting weight. And a lot of people that do those types of things, they'll totally understand and kind of get that. So it's really a trial and error as far as footwear. You put something on, you feel it, is it comfortable, and then you go on the trail and test it out. So that's kind of my spiel on knee pain. If there's any questions, please feel free to reach out to social links.